Hey guys, today we're going to talk about headaches. First, we're going to go through the different types of headaches that you might be suffering, and then the second part of the video will be about treatments and what you can actually do to help your headaches either go away completely or at least reduce the intensity. So stick around till the end of the video if you want to know how to help your headaches. Alright, so about half of Canadians actually suffer from headaches, and if you live in Alberta, specifically southern Alberta where I live, Chinook headaches are a big complaint. We get big shifts in barometric pressure here, and that can cause a lot of issues for people. While you may suffer from headaches, it isn't something that you need to just live with. First, let's go through the 5 different types of headaches that you might be suffering from. First is the cervicogenic headache. This headache, kind of based on what it sounds like, is caused from tissues or structures in the cervical region or the neck. This is the part of the spine that starts at the base of the skull and then ends kind of around your shoulders. These headaches tend to be made worse when you have certain neck movements, or if you're in a lot of awkward postures, whether you're holding the phone with your ear, those sorts of things, or if you sleep funny, sometimes you'll get something like this. Pain in these headaches can radiate around the forehead to the eyes and to the temples, and you can even have pain in your ears. Pain in these headaches is usually reproducible when the tissue that's causing the pain is pushed or challenged in any way. Second type of headache is a cluster headache. These are a little more rare, and you're pretty sure you'll know you have these and you have this diagnosed. These are severe, short, one-sided headaches. They occur in clusters, hence the name, and you can get symptoms like teary-eyed, runny nose on the side, and you'll find that these people tend to kind of have to rock and move and can't really sit still when they're experiencing these clusters. These clusters can happen from a week to a year and be a little more spaced out. In between these clusters, usually this person doesn't have any headaches at all and they're completely pain-free in that regard. These headaches are chronic and difficult to treat, but luckily, being less common, only 0.4% of men and 0.08% of women suffer from this diagnosis. Next is the migraine. I personally suffer from these, so I know exactly what these feel like when a patient comes in with them. We have 2 types of migraines: without aura, which is a common migraine, and a classic migraine or a migraine with aura. Aura is the type of symptoms that precede the migraine. Everyone's a little different with these if they do get them, but it's a neurological symptom that can kind of show up in a bunch of different ways, whether you get like a haziness around the eyes, or some people get what's called a scintillating scotoma, which is wavy lines or black spots in their vision, those sorts of things. Some people will have auditory changes. Some people even get smell changes that they'll get right before a migraine. There's a wide range of this, and pretty much everybody's different. There can even be muscular ones. So we kind of keep learning more and more about that as we do more and more research on migraines. Women tend to suffer from this more so than men, so much so that there's actually a 3-to-1 ratio of women to men for migraine sufferers. People who have been diagnosed with migraines typically know that they have certain triggers, whether this is food, weather, like in Alberta here with the Chinooks. Some people get hormonal migraines. Women will typically get, a migraine the week of or the week before their periods, as well as medications can also be a trigger for migraines. Some people even get triggered with certain food and drinks. Some people will tell you that red wine always gives them a migraine, and that's just from the different chemicals that are found in certain foods. Symptoms of a migraine include typically one-sided throbbing type pain, typically on the same side. For example, I get them on the left side pretty much always. You'll also get nausea, possible vomiting, and light sensitivity, as well as auditory sensitivity for migraines. Tension headaches are pretty common. We see them a lot in the chiropractic office. These are headaches from tension. They come and go, and they're usually described as a tightening or a vice-like sensation around the head. These tend to be from muscle pain or trigger points in other areas of the body, and they just show up as a headache. Outside of migraines, this is actually the most common type of headache. Things like stress, lack of sleep, posture issues, jaw issues, all sorts of things can lead to these types of tension headaches, but they tend to be typically easy to treat because of that. The last type of headache is a pathological headache. So these are the type of headaches that we screen for when we see a patient that has a new or different type of headache. These headaches are emergencies. These need to go to the doctor right away and be tested. This is only 0.5% of headaches, so don't panic anytime you get a headache, but it is something that we do look for in the clinics when we see patients. Causes of pathological headaches can be anything from a tumor, infection, or trauma. Some of the things we look for are abrupt onset, a new or changing headache in an older adult, changes in cognition, seizures, vomiting without nausea, persistent headaches in children, known cancers, and there's some other ones as well. We'll also screen people that have high blood pressure or other comorbidities to just make sure that the headache isn't something we should be worried about and might monitor instead. Now that we've talked about the different types of headaches, let's talk about the different treatments you can get done based on the type of headaches you might be suffering from. If you do have a headache that's caused by muscular tension or a structure in the neck, those sorts of things like the cervicogenic headaches, the tension headaches, and even the migraines, treatment is pretty easy to take care of, but it needs to be pretty consistent. So some of the things that we'll do is, first of all, a chiropractic adjustment. For headaches, we're usually looking at the neck and into the middle back, the thoracic spine as well, looking at joints that aren't moving correctly, as this can cause some muscle imbalances and some joints to be hypermobile as well. So we're looking for things that aren't moving enough and helping them move a little bit better, so hopefully the tension that's causing the headache can go away. We'll also use cups. I use just silicone plastic cups. They don't let us use the glass cups that you need fire to use, like the traditional Chinese medicine doctors use. But this can be really good for bringing the blood flow into the area and just helping reduce tension in the musculature that might be causing the headache. Instrument assisted soft tissue massage. So this is basically what it sounds like. We use a stainless steel tool to help do some different muscle work, and people will call it scraping. One of the things that you can get certified in is called Graston. This is a really good tool for us, helps save our hands as well, and we can get a little more intensely into the muscle for people who have a lot of deep knots and that sort of stuff. General soft tissue work, so this might be someone who has ART or just does a muscle relaxation or release type of technique. We just kind of help work out the trigger points and strip the muscle and do that sort of stuff and just help the muscle relax and move correctly. Exercises. So this is actually most important for most of the things we see in the chiropractic office. We can treat you every day forever, but if you don't do the exercises and the work to address the underlying issue most of the time, you're never really going to get anywhere. So for people with headaches, depending on the cause, doing different postural exercises, strengthening certain things. Muscles get tight when they're weak as well. It's not just about always stretching, so integrating stretching and strengthening is super important. Doing breath work and making sure you're actually breathing correctly, because a lot of people don't, is also super important. So that's something I give pretty much all my patients is breath work. If you do have something like a hormonal based migraine or something like that, it can be a little tougher to deal with it with just exercise. Usually with hormonal migraines or barometric Chinook headaches, what we're looking for is a reduction in amount or intensity of the headaches and shorter duration of the headaches. So we might not be able to get rid of them completely, but we can certainly help with how bad they are and how often they happen. Adjunctive care. So along with chiropractic, which is what I do, I recommend a lot of people to go into massage therapy and help with those muscular issues. To see an acupuncturist, especially for people who have the more hormonal based or food trigger type stuff. Seeing an acupuncturist that's also a traditional Chinese medicine doctor can be super helpful to deal with those underlying issues, help reduce inflammation, that sort of stuff. Seeing a nutritionist is also super helpful. Again, if you have a food or a drink trigger, can generally help with bringing those things down in your diet and figuring out what your triggers might be if you don't know. Stress or anxiety, depression, those sorts of things might be causing your headaches. Getting in with a psychotherapist or hypnotherapist or someone like that can help you deal with those issues and also hopefully help reduce your headaches. Products. So there are different products that can help with headaches, usually kind of just as a support for the more hands-on treatment or the exercises. Things like Epsom salts are great if you want to take nice hot baths and you can kind of soak up the magnesium through your skin. Magnesium is huge for most people, especially with those of us that have migraines or headaches or muscle soreness. Peppermint oil has also been shown to be very helpful with general tension type headaches as well as migraines. There's also other general nutritional supplements that you can look into. That's pretty individual, so that's something that seeing a nutritionist or someone like myself can help you kind of figure out what you might be lower in, and we can kind of guide you in what kind of nutritional supplements you might need. Headaches are something you don't just have to live with. If you have any questions about what kind of headache you might have or what treatments might work for you, getting in with a chiropractor or a physiotherapist is a great first start. If you are a headache sufferer, comment in the box below and let me know what kind of stuff helps you in your headaches. Don't forget to like and subscribe, and I will see you next video.